All right, I want to welcome all of you to Talking Sense. Talking Sense was my my idea on how to come together and be able to address a lot of people's questions all at once. I get a lot of emails during the month, everything from, like I say, practice, policy, and payment. And so I thought one way would be, a clever way would try to have something during a lunchtime where people can just jump on, hear some current news and events, and be able to ask questions in a really informative way. So my idea for the format would just to schedule the first 15 minutes with current events. If you have things to add, please just speak up. And then the last 15 minutes, I was going to have a guest speaker every single month, the second Tuesday of every month, and then we'll take some QA in regards to any of the things that were said, and especially to the guest speaker who has joined us for the day. All of you maybe see a panel on your screen somewhere. I can hear everything you're doing, and you can hear me. If you want to mute yourself, I would look for a microphone that you can click on to mute yourself, and then if you're ready to speak, you can click back on it and you can go ahead and ask a question or say whatever you'd like to say. Can all of you see my screen? Probably everyone's muted.
Tammy, I can see it.
Okay. You don't see a panel or anything else on your screen, is that correct? Are you just looking at the PowerPoint, Melinda?
Oh, yeah, there is a sidebar, but you can go up to the orange arrow and hide the control panel.
Yeah. So I just want to make sure everyone has seen all the icons. Okay. All right, so we're going to move this out of the way. We're going to take off. Melinda Peloquin is here from Creative Billing Services. She is a colleague of mine, very dedicated to our association here in California, and has been very helpful in providing some current information on billing and coding, and is here today to answer some questions and also to go over some important news that we have gotten here in California on Optum Health, which is United Healthcare in other parts of the country, and some new things happening in Medicare. So I really appreciate Melinda taking the time out to join us and be able to ask and answer your questions in regards to billing. I first want to go over some policy updates. As I shared with Megan already, some of you are not from California. This is going to be California driven today because we had just come out of 2 years of legislative process, and Governor Brown busily signed off on a lot of things that had to be done by September 29th that affected both OTs and PTs here in the state of California. Since California is known to sort of set the tone for the rest of the country, you may find that this may be infiltrating news in your area wherever you are. Some of the things that we looked at here in California was AB 783, which we called the POPS bill. POPS is the fancy name for physician-owned PT practices. We also have the POTS, physician-owned OT practices. This bill came up, started a couple years ago. It went dead in July. They actually pulled it off the table and went into the Senate Standing Committee. Once it's in the Standing Committee, it can stand actually in that term for a couple of years and be brought out at some point to go back. There was a lot of money, a lot of fighting that went on with this bill. What this would do would legalize physicians to own OTs and PTs. The reason why there was a big fight from the PTs is that if the physicians can own PTs, the PTs were concerned that a lot of private practices would still go under, and because so many PTs were eager to work for physicians, because physicians can, give them benefits and employ them, that they were the ability for us at the private practice and to support reimbursement would also be jeopardized. As you know, here in California, doctors can actually, and other providers like ophthalmologists can actually provide their own OT and PT without being or having an OT PT in their office. And this has always been a concern of ours here in California. So although this bill is dead because of all the fighting that went on, as it stands, POPs are still legal for now, meaning physicians can employ PTs and OTs. However, if this bill is not brought out and or if the PTs are able to overturn it somehow, it would be illegal. So all of those PTs and OTs that are now working as an employee for the doctor would actually have to become non-employees and have a different type of relationship with the physicians. So talking to PTs around the state, this bill is far from dead, and they are planning on fighting this bill tooth and nail until the end. They just, you know, the other bill that they were also addressing was SB 924, which is direct access, where PTs could go ahead and see patients without a diagnosis or a referral from a physician. This bill also went dead over Labor Day. But it's still on the want list. However, if you ask the PTs which one is more important, they would tell you that the POPs bill is more important to them. They do not want physicians and other medical providers to have the ability to own or continue to provide PT services in California. So I think the jury's still out, but I think we're going to still hear a lot about the POPs bill in the next 12 months. A couple of the other things I wanted to bring up is that here for us to advocate is that not only people with hearing disabilities but with speech disabilities are and can get special speech generating devices for free at no extra charge from the Public Utilities Commission. So if you're seeing any patients who have speech disabilities from things like Parkinson's and strokes, and they need help with amplifying their voice, I would suggest that you call the PUC, go online, look them up, and try to advocate for your patient to get some equipment in the home. The other bill that we followed and passed on October 9th was the SB Senate Bill 946, which allows us to get coverage for developmental disorder and autism. And actually, this was my question to you, Mel, or anyone out there listening. Has anyone begun to bill some of the, do billing and coding for SI and some of the other codes that we've had difficulty getting in the past, getting paid for?
Even though they allow autism coverage, the specific ADL and sensory codes are excluded from benefits for the individual patients. So you still have to dance around and use neuro or therapeutic activities because it's still not covered under the sensory integration code.
Okay. Anyone else had any luck with the billing?
I have a question. Yeah, I have a question. We have not tried to do anything, and one thing that I have wondered about with this particular bill is a lot of stuff that I read made it sound like that this then allows more like for billing of ABA as opposed to not really impacting directly the way we had been billing prior to this because, you know, again, we're using sort of that medical model piece. But what I've really wondered about and happens with some of our clients as well is sort of the other behavioral piece. You know, if we're billing under like, you know, therapeutic exercises or something, it really doesn't address sort of the fact that we may be talking about a particular individual who's got all kinds of behavioral stuff going on, and that's really more what we have to address first to even be able to do anything else. Are there any thoughts or, you know, has anybody addressed that? I mean, like, that it seems like insurance companies always want to put us completely under the medical model, which in some ways is okay for some patients, but then what about those sort of behavioral pieces that also play in with some clients, and here would be a good example of that, and yet they still want to keep us under the medical and not mental health services.
Right.
That's classified by the diagnoses, and unfortunately, the classification for autism, pervasive, even stuttering right now, is classified as a mental disorder and subject to exclusion. You'd have to ask the particular insurance company specifically if it's included or payable diagnoses, and again, they always reserve the right to come back and say no. You know what I mean?
So are you Mel, are you suggesting then that in order, I mean, it sounded like the concern was it's a mental illness with behavioral issues, but, and you're saying that it falls under mental illness, but we're billing with medical codes, right?
Yeah, it's autism itself and pervasive disorders and very similar diagnoses. They have a classification that they fall under, which is considered, hold on. It's classified as number 5 under the CPT book for mental disorders, and that's any diagnosis code 290 to 319. And while they may cover it, one insurance company may cover it or one plan may cover it, that doesn't necessarily mean that all insurance companies will. I mean, we talked, Tammy, with OTAC a few months back, or actually last year also, Aetna and Cigna consider coordination, which is right in the same category as GATE for physical therapy services. They consider that investigational, and they won't cover it. So you have to kind of dance around the issue. So everybody hasn't jumped on board yet. You have to specifically ask and give them the diagnosis code to find out if they'll actually cover it. But then even as a secondary or tertiary diagnosis, if you have something because the child has hand-eye coordination issues and you have that diagnosis in there, they will find a reason not to cover it. And each particular insurance carrier is different on what they will and will not cover.
I know that tonight we have our Autism Task Force teleconference, and I will bring this back up. You know, what often happens is that bills will pass, and this one's just recent. I mean, October 9th was, you know, almost last week. So a lot of times these bills pass, but the provisions have not been put out, and waiting for insurance companies, you know, to get the word out that it is it is now supposed to be on a covered per service plan contract, and then for us to sort of seek out which codes are they going to allow us to use for this. So I will bring this up tonight at our task force meeting and see what we can come back with. And it sounds like we just need to continue to reach out and let each other know if people are what they're using, if they're billing for any of the SIs or other codes than what we have been doing in the past and getting covered. The other thing I wanted to mention is that the athletic trainers again have gone before the Senate Bill 1273. It failed to get out of committee again. It's dead back in April. I don't know if they're going to bring this bill back up. It seems like every legislative, process they do, but the word on the street still from the PTs is that every time this bill comes up, the PTs will continue to fight this forever. Their concern is if athletic trainers get licensed, then the doctors would find a way to hire athletic trainers at a cheaper rate than PTs or refer to athletic trainers to do something similar. So I don't know how often they're going to bring this up, but they continue to bring it up, and it continues to not get out of committee, so we'll see what happens next go around. The other important thing I wanted to bring up is AB 2370 was a change of term. So any of the literature, especially us in practice where we see the words mental retardation, that word term has now been changed to intellectual disabilities. And so we just need to start integrating that into our practice and our terminology with our individuals. The couple of key things that came up in our state of California, which is really important to me, was the Telehealth Advancement Act of 2011, which was AB 415. Governor Brown made this one of his legacy acts, and so I'm excited to know that we actually OTs, PTs, all of us were really involved in some of the fine-tuning of this bill when it was passed last October. What that means for us is that we can provide telehealth in the state of California. It replaced an old term, telemedicine, with telehealth. It allowed all of the healing arts, of which we are categorized here in California, allowed us to provide telehealth services. It eliminated the requirement for an in-person evaluation, so everything can be done start to finish, either interactively or as a store and forward relationship. It allows for verbal consent and does not require a written consent. However, the insurance companies may still require a written consent. And just like the next item here that you see, the insurance companies may also limit the physical location of where the services can be provided. For example, Anthem Blue Cross will not pay for services done in the patient's home. So again, even though the bill allows us, it says you can do all these things, insurance companies may decide that they're going to place restrictions on what they're going to pay for. So we're just excited to have this bill come out, get passed, and we begin to do and be able, without worrying about it, be able to do telehealth in California. Again, it does not mandate that they have to allow us to provide services, and reimbursement has to be negotiated. So good for us. Now we just need to get everyone out there and doing it. And on the heel of that came Assembly Bill number 1733, which we were also involved in. And this was really a bill full of just details on things that were missed in previous bills throughout the legislative process. So as you look down there, you'll see that it just basically puts together this paragraph saying that any healthcare practitioner that is under Division II, which is healing arts, providing services, will be subject to requirements and definitions set forth to their profession. So this allowed our association and board to just write regulatory language. We do not have to open up our Practice Act to change it to say telehealth. It allows us just to write some regulations. And here in the state of California, that regulatory language was written. It went to the board this last week, and I don't know if it's passed out of the board or not, but as soon as it has, I will certainly let everybody know. When I read it, it was sent to committee that I'm on, the Telehealth Ad Hoc Committee. We read the regulatory language, and it basically says that all services provided through technology has to equal and be as qualified and quality care as doing in-person services. So no surprises in the regulatory language, which I'm glad to see. Practice update. So I just want to touch base on a couple of things that can continue to come through my inbox. One is when you're working as an independent contractor. A lot of people email me to say, I want to work on the side. I'm already employed somewhere else at a school or at a clinic, but a family wants me to come and see their child on the side. Can I do that? And the answer is yes. And in the state of California, the minute you take money, you're by default a sole proprietorship. And you can stay a sole proprietorship, or you can change and become some other tax structure. Here in California, to do clinical work, you have to be a sole proprietorship or a corporation. I wanted to highlight that you cannot be an LLC. An LLC tax structure in California only allows clinicians to provide consultation services and not clinical services. So I always recommend just setting up a separate bank account to make it easier for auditing and tracking. The federal government says that if you make it $400 or more, you must file a federal tax return, especially if you decide to rename yourself to a company name. And in state taxes, the minute you earn a penny, it's considered income. You're going to just deposit in your bank, and you're going to pay taxes on that income. So again, yes, go ahead and work on the side. Just remember that you are now a sole proprietorship, and that means that quarterly taxes could kick in for you as a sole proprietorship, as a private practice owner. One more thing I wanted to just highlight is that we are definitely moving into the age of digital healthcare and the use of social media. I came across this amazing stat which just lets me know how much people are going to the internet to find healthcare. Again, as you can see here, we have people using social media outlets to connect with health organizations or to look at and read about health care. And I bring this up because if that is the case, then we need to make sure that we're getting great information out to those consumers who are looking. All those people who've lost jobs have lost benefits, and they can't afford to go to the doctor. So it makes sense they're going online to look up how to treat themselves. And so I would offer up to you that you may want to consider opening up an organizational Facebook for your company in order to reach out to people I know that a lot of OTs and PTs have put small clips on YouTube to demonstrate particular exercises or things for people to do at home, because that is sort of a public domain that people can easily find. I know for me, on the ad hoc committee at AOTA, we have a Facebook page that you can look at just to see what that would look like for a company, and it's called Occupational Therapy in Telehealth. And if you put that in your Google search, comma, Facebook, you will bring up the Facebook page that was developed for telehealth. Okay, I want to move on to Melinda and billing and coding. And Melinda, I'll just let you take it from here if you want. Melinda was involved in a sit-down meeting with Optum Healthcare last month, where we brought up to them several concerns that we had in just being able to, I guess what's the word, get coverage, get reimbursement for services, and a couple of things that,
regarding clinical submissions and payments, yeah.
So you want to just go ahead and mention the idea. I think what we found in that conference that you were in, and I was there in person, is that people were not calling two numbers. Do you want to just talk about why they would need to call two numbers, and or why they call one and not the other?
Yeah, most providers think that if they call customer service that they can get benefits and verify if clinicals are required for contracted providers. However, you have to contact a different number, the 888-329-5182, and punch in the group number. It's completely automated system, takes less than 30 seconds, and then you call customer service and verify occupational therapy or physical therapy benefits at that time, because the customer service reps do not have access to whether or not the clinicals are required, and it impedes payment, because if they are required, they will not pay you for any visits at all until you obtain it, and they don't like to go back and do retro. So it makes it very difficult. We also suggested that Optum do like most other insurance companies, Blue Cross, Blue Shield, Cigna, Aetna, and create a fax back line for EOB copies, because they're pushing electronic funds transfer, but not everybody has access to their online portal because they either have a Mac, which doesn't work, I guess, or they don't have access to a computer in their office, and by the time they get home, they're too tired.
Okay, so Mel, are you recommending then that everyone call the 888-329-5182 number first, regardless?
Yes,
right?
For all patients, and verify the group before you call for benefits or see the patient. You should call and find out if clinicals are required, because the patients have information, the PSF forms that they have to fill out as well.
So when we use the word clinical, for those who may not be familiar with that, we're talking about clinical, what do they call them, clinical protocols?
I believe
clinical
so.
guidelines.
Yes.
You have to fill out some paperwork, basically, and get prior authorization. And then the second number they call after that is the 877-842-3210, or the callback number on the back of the participant's ID card. Right, to verify benefits and coverage, regardless whether or not you've called the first number.
Correct.
Uh-huh.
Yeah, because they may have limited benefits, or they may have already used most of them, you know, deductible coinsurance, and there are still a few plans out there that do not have occupational therapy coverage.
The other thing that came up was, thanks for that, the other thing that came up was that we recognize that OTs and PTs are so busy providing care that they don't often go online to look up Optum, this website, this web link, myoptumhealthphysicalhealth.com. And so while we were sitting there, Optum administrators were there with us, and they were taking us online, and you could see that they have all these additional tools and resources and tutorials for claim submission right on their website. So they're trying to make it easy for us. We were suggesting it wasn't easy, and they were saying, how much easier can it get? We give you some of these tools. And of course, you know, our fault sometimes. People don't have time to go online to look through all that. You know, we just want the how-to. He did show up. There was a page, though, somewhere that we did look at. It seemed like it was sort of a quick cheat sheet where it just said do this, 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 and this, right?
Yes.
Do you remember what that was? That under tools, or do you remember where exactly it was that we looked at that?
Not exactly, but probably under tools.
It was pretty easy once you clicked on there and just followed the sentence by sentence. It was a quick way to make sure you'd done everything you need to avoid denial.
Yeah.
I think that's what I have up there once you log in. If anyone else is having problems with Optum Health, will you please email Melinda or I? We have a meeting with them on Thursday. We have quarterly, no, it's twice a year, biannual meetings with Optum on a telecon, and we go over several things with them and just trying to represent the needs of the providers and try to get information back. All right, next, Medicare threshold. Melinda, I'll let you take this. Go ahead and talk.
Thank you so much. Hopefully everybody is familiar by now with the Medicare threshold and all of the stress that it has caused for everybody. It started October 1st, 2012. It's broken out into phases for providers, basically broken down by volume is the best way I can describe it. After the patient reaches their occupational therapy cap or their physical therapy and or speech limit, then you have up to a max of $3,700. Medicare stated at the beginning of October when they were having difficulty with the website and the automated system that you could call and talk to customer service representatives to find out an individual patient's threshold amount. But now it's actually on the IVR system, and you can call and put in your provider number, the last 5 digits of your tax ID and your NPI, and the patient's health insurance claim number, HICN, and their date of birth, and pull up eligibility information, how much has been applied towards the cap, and also threshold. I don't know exactly which code you have to punch in order to get the threshold information, but we made a phone call yesterday and found out that it is there now. So they've had some issues. Medicare has a lot of information on their website, palmettogba.com/J1. Authorization is required for the providers depending on which phase you're in. So if you are assigned to phase 3 and you have a patient that's already used $4,000, then authorization is not required to be submitted until just prior to the phase, your phase beginning. Tammy, I lost my screen.
Oh, I don't know. I'm still here.
Okay, there it is. Does anybody have any questions?
So, Mel, my understanding again is what you shared with me is that people were sent a letter in the mail and they were told what phase they were in. Is that correct?
Yes.
And on this letter, were they told what to do? So some of the information you just shared with us, like going to a website or calling in, is that on that piece of paper that went out?
No. No, we had to go online and search for it and attend open door forums with Medicare, go to the website. We had to link up to some different outside entities to get information, emails, like for anyone who signed up for emails from Medicare, they were sending out bulletins, but you had to go and look at outside information in order to get it.
All right, and this is just temporary, right? It ends on December 31st that you have to call in and...
At the moment, yes.
So after December 31st, on January 1st, if it does end at the end of this year, you don't have to go in and determine whether or not you've reached threshold. Is that correct?
No. No, everything starts all over. The patients all start at 0 January 1, and hopefully the cap will start over, but it's always tied to tax bill.
Right.
So again, Medicare will make the final rule in March and decide whether or not they're going to do payment cuts or keep the cap extensions or cut it. So we never know until March.
Okay. Well, and we'll also probably depend on who we have for president. Is there anyone there who has questions for Mel about Medicare or Medicare threshold? Okay. Anthem Blue Cross. Mel and I were talking that Mel has noticed something anyway in her business, that it seems like Anthem is assigning codes to disciplines. And we were just wondering if anyone else was getting denials for certain codes because those codes were deemed to belong to physical therapy or chiropractic services. Has anyone been getting any denial EOBs back?
Megan, that's a yes or no?
I don't know.
I'm sorry, I put that yes. I put that yes a while ago. I'm not from California, so I'm just.
Oh, okay.
Has anyone else had any issues with Blue Cross that we need to bring up either to OTAC committee or a sit-down meeting with Anthem? Okay.
Blue Cross has been assigning manual therapy as a physical therapy and chiropractic code and not deemed payable under occupational therapy services.
The only one that I've had trouble with, and I don't remember if it was Anthem or who it's been with, but and I've talked with both of you in the past about this, that there have been a couple of testing codes that really are like for psychologists apparently, that are like developmental testing and neurobehavioral status, that kind of thing that I'm told that only psychologists or physicians are able to bill, but I don't know if that's the kind of thing that you're talking about.
No, are you contracted with Blue Cross?
No,
okay.
No.
If it's Medicare, if it's a Medicare approved code, then you should be able to bill it. But again, all developmental codes, like with the sensory for autism and pervasive disorders, they're subject to their own internal review and benefit exclusions for the patients, which are not published. So unfortunately, you have to call and ask them if that is a covered code.
It sounds again like we really need to look into the whole category of behavioral health and codes related to behavioral health to see what's going to happen with them. If we can, besides sensory integration, do we have a lot of other behavioral health codes that are on our long list?
You mean like ADL, or are you talking diagnoses?
Well, that's what I'm saying. I wasn't talking about sensory integration. I was talking about, with any of the kids that we see, that a couple of the the testing codes.
Oh, testing.
The testing codes, not for sensory integration, because that's sort of a whole separate issue.
Okay.
They've been deeming that to be an experimental procedure, is what they say in terms of that, so they don't cover it. But in terms of testing codes, there's one for like neurobehavioral status and one for administration and implementation of developmental tests. And we do pretty extensive evaluation with children. Even if they're a true motor kind of kid, we do pretty extensive testing. And, it seems like just the OT evaluation code isn't as specific as something like this, but many of them are then claiming that we don't have the credentials to actually use that. At one point in the past then, Tammy, you'd been really helpful about, citing our practice framework and all of that, and they did change their mind, and then I was able to refer back to that EOB for a while and was getting coverage, and then all of a sudden they finally said, no, doesn't matter, we're not covering it, you're not the right credentials.
Do you remember what those code numbers started off with?
Oh yeah, I can tell you exactly what the codes are. One second. They are 96116 and 96111. 96116
and 96111?
Yes.
Okay. All right. Well,
yeah, we also haven't been able to utilize those codes in several years. We actually had to flip over for commercial carriers to the 97750, broken down in increments of time.
977 what, Mel?
97750.
You're using that instead?
We have to.
Mm-hmm.
We used to also get paid on the consultation codes, and then they decided that it was outside the scope of practice for occupational therapy, but we haven't built it in, I don't know, at least 4 years.
All right.
And then like a similar one is also 96150, which is the health and behavior assessment.
Mm-hmm.
And that's one we haven't been successful with either, but it seems like there are cases where that would be appropriate.
Well, you know, these are all great things to know, because what I'll do is, I've been writing this down, I will take these codes back to committee to see, and since we have a task force developed, and Dr. Clark heads up that task force here for us in California, it'd be nice to be able to come to the table while this law just passed in October, and there may probably, you know, in that's what we do, help them be there, set the table when they're doing these provisions. It'd be nice to be able to offer up to see if we couldn't put forth some codes for coverage.
And also it was a year ago that it passed, just by the way. So.
Oh, a year ago.
Yeah.
Yeah, you know what, Mel and I were talking about that. You know, Mel and I worked together post workers' comp passage in 2004, and there's so many parts of workers' comp that still doesn't work. They never implemented it. You know, it's on the pages, it's law, but we've never seen it really happen. So again, our job, which is great, our job as through our associations, right, is to put pressure on the stakeholders to really push through the right channels that, you know, it's a law, it's legislation, and they should be allowing provisions to go through that allow us to use it, you know, to use codes, to get paid for. And so I will bring this back up again and see if we're at a better position, you know, to bring these things up.
That would be great. I printed some stuff for you, Tammy. I'll fax it over.
Okay, good. And then, Mel, there was one more kind of current event and merger between Universal SmartCom, right?
Yes, information is still coming in on that, and I haven't retained it to memory, but evidently in September, Universal SmartCom and Align Networks have merged, and so they're going to make our lives miserable even faster. No, I'm just kidding. I still can't tell. It looks like if you have a Universal SmartCom identified patient, then the claims go to a different address than they do if they're aligned. But like I said, the information is still coming in. You have 30 days in which to submit billings, and all chart notes must be sent in with the initial claim, not subsequent claims. We've actually seen them deny claims for timely filing when the chart notes weren't sent in the first time.
Wow.
According to this, it says that they're going to be offering like 80% of Medicare, but they have a limit of $63 per date of service.
Okay. Seems like everyone seems to be gravitating towards the 60s, right?
Yeah.
For these flat fees. We have Optum at, you know, 68, and we have, you know, Align at 63. I don't, you know, it just makes me, you know, it gets my blood boiling when I think we spent all this time, you know, with all of our great expert services and education, and they think it's okay to reimburse at $63.
Well, on the good side, on the plus side, it says initial evaluations, 97001 and 003.
Yeah.
State-specific codes are excluded from the daily maximum reimbursement. So you should be able to get reimbursed for that in addition.
Okay. Well, that was our fight with Optum Health, by the way. While we were there, we really brought that issue back up where we would like to be allowed to eval and treat in the same day. I don't know that we felt you know, they listened. They didn't say yes. They didn't say no. Right, Mel?
They're thinking about it. Yeah, they're thinking about it.
They're thinking about that to see if we couldn't, you know, be able to, you know, code and bill for eval and treat.
Well, since it's mandated that we report back to the referring physician, there is more time associated with that initial assessment. There should be additional monies associated to it, like there was when ACN first took over United Healthcare back in 2006. They had one price for the initial eval and one price for the treat, and if you did both on the same day, you got double. So they streamlined everything back in 2009, 2010, and got rid of it.
Right. They're into streamlining. Okay. Any more questions for Mel before we go? I know I'm trying to keep this short and sweet, but I want you to have the opportunity to ask Melinda any specific questions that you may have.
I do have one other specific question. It's Terry again, and as you can gather from my questions, I do pediatrics. And so there are these kids who are sort of more the SI kids, and of course we can't, bill that route. But sometimes those kids, the way it's really showing up more than the motor is more a true behavioral, like a traditional old-fashioned OT mental health client. It's coming out in behavior, frustration, those kind of things. And therefore the traditional motor codes really are not at all appropriate. Kinetic activities, therapeutic, you could sort of say therapeutic exercises in that we're like trying to do roles and routines and things like that, but it seems like it would be more the true mental health. Are there any other like more mental health-like codes that would be more appropriate to use? And if so, is anybody willing to cover something like that?
Terry, I'd have to say no, since most insurance companies are still fighting, autism, stuttering, developmental delays. They're still finding reasons not to cover it, and all they say is that it's an internal determination. Unfortunately, I hate to say it, but it's a game. It's political, and we've been talking about this for, oh my goodness, since 2005. All of the pediatric therapists you have to use, unfortunately, what the insurance companies will cover. And it may not be right. I know it's not right, but you have to do that until legislation changes it.
Well, I guess that's why I was bringing it up. Yeah, that would be the other thing that I'd ask Tammy if she can relay to this task force that she was mentioning, if they're sort of addressing this behavioral health piece. They may or may not even have the autism diagnosis, but there is this other piece that, at least if they could get coverage for it, then maybe down the road there'd be help for some of the kids who don't have those actual diagnoses. But that would be another example of where we don't have an appropriate way of coding it or getting coverage.
Right. I will bring that up, and within the autism task force and the autism committee, I get involved because we can, in the state of California, we can now provide telehealth services for autism, and that was a big push through this last legislative process. But like you're saying, now that I can use technology and break down barriers to access to my patient who may be at home or somewhere else where I can't get to them, we need to be able to code and bill. And I know Melinda and I have been speaking about that off this webcast, on how we can really get all the pieces together to make this easier, especially when we're in a state where we now have an autism month, which is April, I think, and we have a lot of this legislative support behind autism, but yet we struggle on being able to get reimbursement for it if we were to bill the way is representative of the skills that we're using, the diagnoses that we're treating. So I will continue to bring that up and see where that's at, and how we maybe can go about through the Association of OTAC, bringing awareness to this as these task force meet up in Sacramento. I need to get in front of Dr. Clark and get this information to her, I guess, that way, because it is an issue.
Yeah, you may also want to, Tammy, add 92526
92526.
It is covered most of the time by some insurers, but not all.
What is it?
It's feeding, swallowing treatment
feeding.
For pediatric occupational therapy.
Okay.
Blue Shield will pay it occasionally, but not consistently.
Mm-hmm.
Blue Cross, if you're contracted, you have to add it to your contract. If you're not, I don't know. I haven't had any out-of-net providers bill for it, so I don't know. Everybody, you know, in order to keep their patients, they have to be contracted.
Right. Okay. Well, I think it's important, too, to see what the ABAs are doing, because I know some of the laws, the legislation that came out was really supporting the behaviorists themselves, who is a new group of people for us to have, you know, as stakeholders involved. I mean, now, you know, we've always worried about other disciplines. The behaviorists are really making a go at this, and they were the first to really want to get telehealth involved. So, you know, and that's more kind of physician driven. So again, it sounds like it's finding the eval codes, first of all, that we could use that represent the comprehensiveness and the complications that in the length of an assessment for these types of clients that we have, and then also finding the procedure codes that are more representative of what we're doing with them. Right. Otherwise, right now we're just picking out physical, you know, conditions.
Because we know that's what they will cover. So
yeah.
Yes, thank you very much. I appreciate, you know, sort of having you to be able to feed some of this through to try to get the support of OTAC to see if we can get anything better.
Okay. Good. All right. Well, let's close up shop for today. Next month, I will send out an email again. I'm going to have a OT here, I'm hoping, Bonnie from Blue Barmo Gaming, and they are a gaming company who is using gaming to treat TBIs, but what I'm excited about is that while people are playing this game, it's actually capturing important data for the therapist. So if you were to use gaming for your participant, your patient as a home management program while they're playing this game, data is being gathered and sent back to you that helps you to set a new plan of care or work on certain skills with the gaming. So anyway, I met Bonnie at the OTAC conference. I'm going to go down and take a look at their headquarters and all of the great things they're doing, and then hopefully she'll join us next month. Thank you, everybody.
Thanks, Tammy.
Thank you.